a lot of the things that you outlined today did not happen by happenstance. This is a direct result of what the government has or hasn't done over the last few months. I did not hear you take responsibility for that in your opening statement. I do not understand why, with the public demand out there, that you are not expressing an apology for missteps, misjudgments, and being absent on this issue. So my first question, I'll only ask two, is that can you tell us why you haven't apologized or why you are not apologizing for the government's actions and the situation we're now in? And will you take the opportunity to do so now?
Thanks for the question, Marie. And I take everything as Minister of Health as my responsibility, and ultimately it does land on my desk. So I absolutely do take responsibility for everything, the good, the bad, and everything in between that happens within the healthcare system. As far as what we have done in the past, what we have always done is we make decisions at points in time. When we made the decision of coming off of the public health measures back in June, our rates were coming down, and we had that July 11th target date of 70%. We hit that target date and we started to move away from all of our public health restrictions. Then as the numbers started increasing, there were other public health restrictions that we allowed the schools to be able to move to different areas depending on what their COVID outbreaks were in their specific schools. And now we've come in with a host of measures to be able to make sure that we're trying to control the numbers. We started with the allocation of the emergency order, reinstituting that, which wasn't taken lightly. That we brought in so we can move our healthcare workers around to address this insurge that we were seeing in the health care system. But we've also implemented massive health restrictions in the last little while. And we're continuing to do that, Murray, based on the information that we have on hand.
I don't understand, sir, how that takes into account or the missteps of government. Do you recognize that you've made several missteps as government? And moving this forward, many people, obviously the opposition, have asked for your resignation in this regard. I get that happens in politics a lot, but it's actually being asked by other people that aren't in politics simply because they do not see you and your government having taken responsibility for your absence in the last few months, for the missteps and misjudgments on the severity of the fourth wave. Did you consider resigning? And once again, I am a little unclear as to whether you were actually apologizing or not, because I didn't actually hear the words, and I'll bow out.
Well, thanks, Murray. And again, I've taken all of my responsibilities extremely seriously, from not being an MLA to being Minister of Social Services and now Minister of Health. There's no set playbook on this. We make the decisions we make at a specific point in time, looking at all factors out there. There's many factors that are out there. There's modeling information, there's case counts, there's positivity rates, there's hospitalizations, there's ICUs. There are many things that we take into account when we make those decisions at a point in time. But I do, and I certainly want to convey that I take everything very serious. There hasn't been a day this year where I haven't been in contact with my officials, with my chief of staff, with people within the healthcare system. I have yet to take a day off to be able to manage this unprecedented time that we're in the best we can possibly. So I do appreciate the question, Murray, but I do take everything that I do in the past and in the future extremely seriously.